So good morning, everyone, and welcome to this morning's session of the Joint Standing Committee on Health and Human Services. We'll be having a work session on one bill and then hearing about a lot of language revisions as bills pass through our committee before we adjourn. So let's start with introductions, and I see Representative Zager.
Happy birthday, Mr. Chair. Thank you. I'm Sam Zager, honored to represent District 41, which is part of Portland.
Next person first, my birthday is out of order. So Representative Lemelin.
Good morning, everyone. My name is Michael Lemelin, and I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Nobleboro.
Thank you. Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Griffin.
Good morning, everyone. My name is Abigail Griffin. I represent House District 102, which is Columber, Levant, and Cadasco.
Thank you. Representative Connor.
Thank you, Mr. Chair. Good morning, everyone. My name is John Connor, and I represent part of Lewiston.
And Representative Javner.
Good morning. I'm Representative Kathy Javner, and I represent House District 141, which is located in Penobscot and Washington counties.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Thank you. And we're joined by our staff. You want to start, Sam?
Sorry, I'm used to starting. I'm Samuel Seneft. I'm an analyst with the Nonpartisan Office of Policy and Legal Analysis.
And I see that Representative Meyer has just joined us.
Thank you, Mr. Chair. I'm Representative Michelle Myers, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
Thank you. And the other member, our key member of our staff is Anna.
Hi, I'm Anna Broom. I'm the other legislative analyst for this committee, and I also work in OPLA.
And the clerk for the committee is Karen Thomas.
Hi, I'm Karen Thomas. Happy to be the clerk for this committee. Should you need any assistance, please email me at hhs@legislature.maine.gov. Thank you.
And I don't think I've missed anybody so far. So at this point, why don't we turn it over to a discussion of the 1968. So I will turn to Anna for that.
Okay, well, I was kind of hoping that the sponsor would be here, but I don't see her. So I'm going to share my screen with, I'm sorry, I've just got to find the right, here we go. This is the amendment that you asked me to draft for voting purposes. So the first part, and I apologize for the color, it's so I don't forget things. So this is the piece, and the reason this is the part you keep hearing about is section 4, but because it's the only piece that's in statute, it actually has to be at the beginning of the amendment. So I'm going to start with that. So this is the section that you received language for this. It was actually only a couple of lines long, but needed to be expanded just a little bit to make it fit with the section that it was going into. So the language that I received from the judicial branch was, or rather, the language from the judicial branch, once it was put into this section, says that when a court commits the defendant to the custody of the Commissioner of Health and Human Services and appropriate placement in an institution for care and treatment of people with mental illness or in an appropriate residential program that provides care and treatment for persons who have intellectual disabilities as set forth in subsection 4, that's earlier up in this 101D, must take place within 30 days. So the 30 days is what this was about. So you heard during the work session from Dr. Pollard, and she talked about how it was also necessary to have some kind of extraordinary circumstance because there are a number of reasons why 30 days might not be possible. And I do know she is here. So this language comes from Dr. Pollard, and it has this extraordinary circumstances language in it. And I believe there are a number of reasons that she gave for why there might be extraordinary circumstances, and they're not just around the availability of the bed. It could also be around the person refusing to do testing or whatever else might be an issue. So this was the language that was added. And so I also sent you, and I'll go to that in just a second, that the judicial branch believe that this language is unnecessarily. They don't like the extraordinary circumstances because it sets up a different standard from what they would normally use. Another way to think about it is within 30 days, unless the court finds the commissioner is unable to comply, but that does put it back in the hands of the courts as opposed to the department. So that's where the sort of policy struggle is, I think, in addition to this sort of legal issue. So I'm going to stop this for a moment just to bring up the other piece that you also received. So this was the response that came back from Justice Mills. They had received a slightly earlier version of this language that they're responding to. It didn't have the forensic service in it, but it did have the extraordinary circumstances, and this is what they're saying, and they're citing case law, which I promptly took next door to one of the attorneys in our office to have a look at. So as you can see, they would like not to have that extraordinary circumstances language, and they are just saying that they would like the 30 days. So that's not my call. That's yours. So I'm going to go back to the language now, if I can manage to find it. Sorry, I had it up just a minute ago. Wait, oh, there we go. The one with all the color. You'd think I could see that. Okay, so Part B, which is the old Section 1, this is the piece around main housing. And this language has been I sent this out, and Cullen had some edits to it. So Cullen Ryan had some edits to it. So this is the edit. You have seen that version, this version. So you can see that the target population is defined. We wouldn't normally do that. It was just that it became really clumsy to write this entire sentence in here over and over. So that's why that language is there. Main housing shall provide financing for no less than 50 and up to 200 units of permanent supportive housing. Sorry, I'm just making sure that I actually did send the correct version. So up to 200 units units of permanent supportive housing to the target population. Main housing shall provide financing from any appropriate source, including low-income housing tax credits, the Federal Housing Trust Fund, municipal increment financing. And then there's the geographical spread. That it's sort of two pieces to it, in the sense that there's the service centre side as well as encouraging the geographic spread. And then the affordability piece is in there to ensure that folks that are in the permanent supportive housing receive whatever extent is possible for rental subsidies, but also ensuring that each member receives ongoing housing navigation and continuity in case management in order to access and remain successful in that permanent housing, and receive ongoing behavioural health, substance use disorder, and other medical services that the person is eligible for. So that's the piece around main housing. And then this is actually the part that comes from Katie. And I don't know if Katie's here, but I know that Sarah is. So this piece here was actually pretty much wholly came from them. And this is the part that requires the department to develop a comprehensive residential system of care to serve people in the state with behavioural health needs. And then you can see that they are looking for a system of care shall develop and implement a residential system of care in collaboration with stakeholders. And the plan is developed with a minimum of stakeholder meetings and shall align with the development of the strategic plan, which is, if you'll remember, this is the Senator Breen resolve that requires the department to come up with a statewide plan. And then the elements of the system, and you can see there, this is all the pieces that they are looking for. So a needs study, a gaps analysis. I'm not sure that grammatically correct. We might fix that. A gap analysis is what that should say. And you can see all of that with the infrastructure and the barriers and so on. And then a report coming to this committee regarding the status of the system, including the number of staffed community residential treatment beds for individuals with mental illness, for children with behavioral health diagnoses as well, are also included in there. And the report must include a timeline and metrics to achieve that comprehensive system. And then part D was, if you remember, this was the part that came pretty much fully drafted. It was on the one pager that you received at the last work session. And this is the residential bed availability report. I always have to go and look up biennially and biennially, but this is twice a year. I check it because I can never remember which way it goes. So twice a year for a period of 5 years on the number of licensed acute psychiatric inpatient beds and community residential treatment beds in each geographic region of the state for adults with serious and persistent mental illness, substance use disorder, developmental disabilities, as well as children with behavioral health diagnoses. And the report, so this is it's a different report. This one is solely about beds rather than behavioral health in general. So I'm going to stop sharing, but I can obviously put it back up at any point. Oh, and I do see the sponsor is here now too, so that's good. So there are some folks here, if you want to talk with them about it. I'm just basically the scribe to this, so I don't know where you want to go with it. So I'm just going to stop talking.
Thank you. There was one change on the summary. I understand that's not major importance, but there's a third or fourth line in. It says it requires, the requirement is something like that. But anyway, are there questions here from the committee related to what Anna has shared? Comments, questions, concerns? Okay. So standing in for Representative Talbot Ross, you don't look at all like her. We've been joined by Cullen Ryan. Thank you for being here. And before we get to you, Cullen, I'll give Holly Stover, Representative Stover, a chance to introduce herself.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, West Port Island, and part of South Bristol.
Thank you and good morning. So
Senator Claxton, sorry to interrupt. I just heard that the actual Rachel Talbot Ross is on her way as well.
Okay. Well, as long as the issue's been raised and we've invited Cullen Ryan into did you have a comment based on what you heard from Anna, sir?
No, she covered it very well. I think it's a simple layout. It covers all the things that you saw earlier, but hopefully in a way that makes sense to all of you now.
Okay. Thank you for that. So no comments from anybody here about how this is laid out. I had a question about the distinction, and maybe Anna, you can answer it. Maybe somebody else can, between in the language that Director Pollard wanted added, the distinction between the commissioner being notified and the State Forensic Service being notified. Can somebody speak to that difference?
I think it's probably worth asking Jessica Pollard that, because that's where that language came from.
Okay.
So I just put it right in.
Okay, thank you. Representative Perry, did you have your hand up?
Yes, I did. I was actually going to make the comment that this really looks like a doable way of approaching this, and also puts it in the forefront in terms of what we're dealing with. And I was actually going to make a motion on to pass as amended.
Is there a second for that motion?
Second.
And just for clarity, the amendment that you're referring to, does that include the yellowed language on the sheet? Okay.
Yes.
And we've invited Dr. Pollard in, and she'll be with us shortly. Did I hear a second to that motion from Representative Perry? Okay.
Yes, sir.
Oh, thank you. All right. Welcome, Dr. Pollard.
Good morning.
Good morning. So I had a question about the distinction between notifying the commissioner in section 1 and notifying the state forensic service. Can you help me understand why they might be different in the language?
Sure, I will do my best. I am struggling to keep track of the version from which we edited, but our intention there was to make clear that the 30-day clock would start ticking after the court had transmitted the order to state forensic service, rather than from the date of the court order of when the person was ordered into the custody of the commissioner. So it's really the transmission of the order to state forensics. And most of the time that happens within 24 hours, but we do have examples where that has taken weeks before state forensics has received notification that the person is in custody of the commissioner. And so we just wanted to make clear that it seemed unreasonable for us to be held accountable for the time prior to actually receiving the order from the court.
Very good. Thank you. Representative Lemelin.
Thank you, Senator. I have a point of order. LD 1968, as far as I know, was tabled, and we have not untabled it, sir.
Thank you for that correction, Representative Lemelin. You are right. I forgot that part. So I'll start with a motion to take LD 1968 off the table.
So moved.
And seconded.
Seconded.
Moved and seconded by Representative Stover and Representative Zager. Thank you again, Representative Lemelin. I just wanted to get started. So now that we can consider this further, are there other questions? Did you have your hand up, Senator Moore?
No, I
Okay.
think we need to vote on the tabled motion.
I haven't had my coffee this morning. I've been,
Yeah, I know. But you know what day it is, so that may be part of it.
yeah, when I have a notebook that I keep some notes in, and when I went to write the date, I wrote my birthday,
I love it.
not 22. All right, I think we can do this with a show of hands. All those who are in favor of taking this bill off the table, show of physical hands is welcome. Thank you very much. That's unanimous of those present. All right, anything else I've missed before we try and get on to discussion of the bill? All right. Any other thoughts or comments or questions from committee members about the content of the bill? I'm not seeing any. I also had a question for Dr. Pollard. One of the concerns that was voiced, I think, in the last session was about the ability to meet the 30-day requirement and how soon that might be achievable. Do you have can you speak to that or guesstimate that or reassure us that it's doable in the next X number of months?
Well, I appreciated Justice Mills' point about the precedent regarding contempt and our ability to reasonably meet the time frame. So with that clarification, I think we continue to think that the 30 days is reasonable. And I think part of the question may be in reference to the reduced admissions that we were experiencing at the state hospitals, which have largely been rectified.
Okay. Thank you. Any other comments or questions? Yes, Representative Javner.
Thank you, Senator Claxton. I will just make a quick comment. I have, I appreciate the premise of the bill. I truly do. However, I think that there are still a lot of process points that have not been clarified and that are just a bit questionable for me to put into statute. So I think that I won't be supporting the motion that is on the table. Thank you.
Well, as long as we're still talking about the bill, do you want to identify some or any other concerns that you have related to the bill?
Sure. I think the main one for me is just putting into statute, again, this, directing the department to make such a step in the process of what is being asked for here. The department hears, what we've been talking about, and they have, from what I've been hearing, it sounds as if they're really trying their best to be able to move these patients where they need to go. And so that's really my personal point of about everything that I've been hearing. So thank you.
Thank you for clarifying that. Any other comments that related to this bill that people would like to make or raise as concerns as Representative Javner has? I'm not seeing any. Are we ready to vote then? So if Anna, do you have questions about content that would like to that need further clarification before we vote?
Yes, I do. I'm trying to figure out whether, and I'm sorry, Dr. Parla, just to be clear, are you saying that you want the language that you drafted, or that you would be okay with the language about the unless the court finds the commissioner is unable to comply, in addition to the state forensic service? I'm just a little confused. I'm sorry. Not
No,
your
thank
fault.
you. I think we can agree with Justice Mills about the redundancy or unnecessary addition of the extraordinary circumstances language. We think it is important to specify the date starts from the transmission to state forensic service of the court order.
So it would say within 30 days from the time the order is transmitted to the state forensic service, unless the court finds the commissioner is unable to comply. Is that right?
Sorry.
It's taking out, I know, let me bring it up. Would that be helpful?
Yes, I just want to make sure that I am not in disagreement with Justice Mills' point about the language regarding that component being unnecessary, because it did, of course, I deferred to her on matters of case law, and it does seem as though she thought any of the extraordinary circumstances language was unnecessary.
So you could say within 30 days from the time the court order is transmitted to the state forensic service, unless the court finds the commissioner is unable to comply.
It seemed to me that the suggestion was that the period would go at the end of state forensic service, because the precedent is already that the court would allow for those circumstances. She thought, it seemed as though her feedback was that it may cause confusion to specify.
To say anything.
But I do want to just acknowledge I am not an attorney or a judge.
Neither am I, but I asked our attorneys to. Okay, so that makes perfect sense to me. So it would say take place within 30 days from the time the order is transmitted to the state forensic service, period, and the rest would go away. Okay. Thank you. I just needed that clarity before you all voted.
So Representative Perry, with eliminating the last two lines that are highlighted, are you comfortable with that? Yeah, so it does, the amendment still includes some of that language, but not all of it. Okay. Any other questions or concerns or clarifications before we vote? Then we can turn it over to Karen to tally the vote, if you would.
Thank you, Senator. Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
No.
Representative Lemlin. No. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan. Representative Madigan is absent. Representative Craven. Representative Craven is absent. Representative Connor.
No.
Representative Connor, no. Representative Griffin.
No.
Representative Griffin, no. Representative Javner.
No.
Representative Javner, no. Senator Moore.
No.
Senator Moore, no. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that's 5 yea, 5 nay, and 3 absent.
Yes, that's what I have.
Okay. And So if the yays are the minority report, that it would still be ought to pass. It would still be ought to pass as amended. And if the nays were the majority report, it would be ought not to pass. Is that right, Representative Javner?
Yes,
Okay.
Senator Claxton.
So we have Plan B for either eventuality.
Thank you.
Okay. Thank you for being here, Dr. Pollard, and answering some questions. And thank you, Cullen Ryan, for your efforts.
Thank you for having me.
Thank you for having me as well.
Okay. So we have some language reviews, and I unintentionally left off a couple bills that I'd like to consider moving into the budget, but I will respect the committee.
We were going to review the letter first, if that's okay. So that would give you an opportunity to do that. So Sam was going to go through the memo
Great.
with you so that we can get it set.
That works fine for me. Thank you.
Sorry, if I go ahead and share the letter on the screen.
You were busy putting this together.
Committee is busy. All right. We've got a draft letter here, so I'm just going to walk the committee through the letter. So just as a reminder, the way this works is that the committee sends a letter to AFA outlining what the committee's recommendations are for the supplemental budget. We tried to be as detailed as we could. We will include a spreadsheet of that looks like the green Luke's green sheet with the votes listed out individually, but we also summarize the votes in the cover sheet. So the first thing we did was we took the initiatives that are included in the supplemental and outlined the budgets on each of the initiatives. So we noted that the votes on the initiatives were unanimous in favor of including them, except for the ones that weren't, in which case those were party line votes. So we did list out those votes that were not unanimous with just a reference to the line number on the green sheet, as well as a sort of brief description of what the initiative was about, so that we make sure that everybody knows what we're referring to. The next part here after that is the language sections. These were the language sections that were included in the governor's proposed supplemental. Same thing, we included the votes on each of those there, as well as a description of what that language was about. Okay, the next thing we get into is the proposed initiatives. So the first one is the initiative, you'll recall, for childcare supplements. So this language is language that mirrors 1652. The committee had requested, again, that this language be included to accompany line 41 in the green document. So this describes those salary supplements and proposed language there. That was a split vote. The next initiative that the committee wanted to include was the FQHC and RHC co-payments. And if you recall, the committee had voted to recommend including language to strike out the statutory language that lays out the co-pays for FQHCs and RHCs. So that's a pretty simple just repeal there. Next thing was the COLA increases for center-based community support and level 3 home support. We had just discussed this on Monday. I do want to, I don't know if I should do that now. I do have some costs for some of this. I might actually pull this up now. So if you'll recall, the committee had asked that those COLAs, and those are COLAs of 4.9%, go back to January 1, 2022. And the same thing for this next initiative. This was the $2.36 increase for agency home supports in section 21. the committee had recommended that they go back to January 1, 2022. So you might recall with the way that state plan amendments work for main care is that they need to request from the federal government permission to go retroactive, but they can only do that if they get the state plan amendment request in the quarter. So they are not going to be able to get those in time for those to be effective on January 1, 2022. So Luke somehow turned around some really quick numbers on these. So I have this up on the screen here. And what he did is to go through and identify what initiatives we would be able to claim federal match for, and what ones would need to be all general fund or other special revenue funds. And he laid out estimated costs for each of those here. So this is this first one here. This is the updated cost of living adjustments for center-based community support services, as well as the home support level 3. And the general fund costs there, looking at those numbers, 2.3 in fiscal year 22, 1.6 in fiscal year 23. You'll note there is no federal match here for 22, and that is again because the department would not have time to go back and get retroactive. So that is going to be state money there. And it's the same here with the $2.36 an hour increase. That is all state money there for this fiscal year, again because of the timing issue. And then at the bottom you'll see this is the total cost of those two proposed initiatives plus the blood spot, which is the $550, but that wouldn't be until July 1. So the total cost here, are listed below. So, you know, the committee has two. I'm gonna toggle back to the letter. The committee has two options here. If you want to keep the January 1st effective date for these two initiatives, that you can do that. Just we just wanted to give you a heads up that federal match would not be able to be claimed for the time period of January 1 to July 1. The other option the committee has is to change the effective date to July 1 in order to be able to claim federal match, and that is again totally up to the committee. We just wanted to bring that to your attention.
How about Sam, language to the effect that the change we made is
Did we lose Senator Claxton?
Oh, did you hear Sam, my question? Yeah, my question was, could the language be changed to as soon as possible, consistent with federal regulation? It wouldn't change.
To have it be effective as soon as, yeah. Anna, do you see any issue with it being worded that way?
No, it just makes it harder to price.
Right.
It means that they have to guess on that, whereas July 1st would be a lot easier to price. That's your call.
Well, it sounds like they've had to guess already to get us to that analysis that Sam just showed us, right?
No, I mean, they would have to, if they have to guess on the date, then, I mean, the numbers are somewhat real. It's just they would have to guess on when it happened.
Okay.
Whereas July, it's your call. You can certainly do it that way. And I'm sure that they will adjust, but you could. But in practical terms, right, Sam? I mean, it's going to be July 1st.
Yeah, I think just in terms of
okay.
When this, yeah. But.
Okay. Representative Zager?
Thank you, Mr. Chair. If it's done by the quarter, then what would be the implication if it said April 1st?
I don't know that they're going to be able to. They could. I think it's a little dicey whether that would, with the budget, by the time the budget gets passed, if they'd be able to get that in time. They might be able to. There's some, so just to be a little more detailed in my explanation here, that in order to submit a state plan amendment, there's steps that the department has to go through first. Like there's this whole process of submitting a state plan amendment. There's certain like consultations that the department has to do. They may be able to get it in April 1st. I think it's more likely going to be July 1st by the time they get through the whole process. But we could word it as soon as possible, and I think there's a small chance they could get it in April 1st. I'm just kind of going through the process in my head. I think it'd be a close call.
Whereas if you put April 1 in the language and it didn't get done, then you would find yourself, they would have to pay it with general fund.
Right, you're kind of hedging there, yeah.
Well, that's why I raised the issue of consistent with. So it reflects that we don't know exactly when that's going to happen for budgeting. Your thoughts about that, Representative Zager?
Yeah, it sounds like it's there's some ambiguity either way, and so I think I'd be in favor of what you suggested, Senator.
So how about making it July 1 unless it can be done sooner, consistent with federal regulations?
Okay.
Is that usable?
Yes, I think I can word that. Yeah.
I saw a head nod or two. So, okay.
All right. So that, okay. Sorry.
Comment, Senator Moore?
Yes, I totally understand this and how the whole process works, but I know that the folks that this is affecting will be disappointed, that they were hoping they were all going to get back to January 1, 2022. It's just not feasible. So I just wanted to make that comment. I'm sure that they are not going to be happy.
Yeah. Thank you. Go ahead, Sam.
All right. So that would be applicable to 3 and to 4 here. So the blood spot, so the reimbursement for blood spot screening, so that we were looking at, so that would be, I think that we were assuming that would be July 1, that would be in effect. So that, just to remind you how that works. So this is it's not actually paying for the screening papers. It's raising the reimbursement rates for the blood spot screening tests that MaineCare does pay for, to account for the increased costs in the papers that providers need to purchase to do these tests. Does that make sense?
Yes.
Okay. All right. So now we're getting into the list of bills that the committee had voted to move into the budget. So what we did here was simply reference those bills. So this first set of bills are bills that have been reported out of committee and that are currently sitting on the table. So we've listed all of those bills out here that the committee had voted to include. These are all unanimous votes, 13-0. So we listed each of those out there. The next set of bills is bills the committee voted to include in the supplemental, but that have not yet been reported out. So this is a little bit of a tricky situation because they don't have the final amendments on these yet. So what we are planning to do is to attach to our letter the most up-to-date version of the amendments that we have for each of these, so that the AFA committee can understand what it is that the committee is recommending. And I think we have amendments for them all. They're not all in final form yet, and they haven't been reported out yet. But I think it'll be sufficient for AFA to understand what the committee is asking for with each of these bills.
Well, some of those bills they already have in their possession, right?
So the ones in this list above here are the ones that are on the
Oh, yes, right, okay.
And yeah, so these are kind of still in process, but that was our plan. Does that sound okay to the committee? That was kind of the best process we could come up with.
Any comments, folks? I don't see any hands up, so if that's, yeah, Senator Moore?
My only comment is to thank you guys for this. Very well done. To put it all together like that. I think it's very easy to read, and I think it'll be a great tool to be able to present to AFA. So thank you. Thanks for the hard work on this.
Sam, can we go back up to the top again?
Yeah.
Where you listed the initial set of bills that we voted on and referenced. So are all of so the page that or the numbers, if you go up a little further to the front end of the letter, beginning of the letter. Okay, so this list here that starts with line item 8, those were all unanimous votes until we get.
So these are the ones
where?
that were not. So we said they were unanimous except for the ones that are listed.
Okay.
So we're going to attach that Luke document, the green sheet.
Yeah, okay.
And then we have the vote listed on each individual initiative, but we wanted to call out the ones that were, I think AFA likes to know if they were divided reports and along what lines.
Sure,
So
sure. I didn't see it reflected in a way that I hadn't read that paragraph close enough. Thank you. Representative Zager?
Thank you, Mr. Chair. I was just cross-referencing list upon list here, and thank you so much, Sam, for compiling this. I'd like to query about LD 372. This is would increase CHIP, expanding health insurance to about 10,000 Maine kids. There was an 11-to-1 report on that ought to pass as amended. If I have this recorded correctly.
It's not on the list, Sam. Stop looking.
Oh.
Okay.
Carry on, Representative Zager. I could see Sam looking for it on the letter, and it's not in the letter because it wasn't there. You might want to minimize now, Sam.
So, Mr. Chair, I'm wondering if we might discuss that as a committee to see how we feel about including that in what we send to our report to AFA.
Do the analysts have any feedback about the idea of putting it on the list in its own category, because it would be the 12-to-1 vote?
Well, no, it would go in that second list that Sam has, the second group of bills that some of those are divided and some of those are not. But
Okay.
that's where it would go if you decide to go there.
We would just have to change that language, but that's easy enough.
Oh, you mean because it's a different vote? It's not a party line or right? Yes, yes, we would have to add that.
Right, that's what I meant. Yeah, okay. So Sam, was it intentional to not include 372 when you put this letter together?
You didn't include it.
Did I miss it? Or
No,
did we?
you did not.
Okay.
They didn't include it.
Okay.
I think the original bill was the 11-to-1 report. It may have been an oversight on the committee to not bring it up. I'm not supposing that there was a clerical error.
Okay, all right. I was unclear about that. 372 was not brought up to be brought in. It wasn't raised as an issue on the budget. Now that I found my notes, thank you. Representative Javner?
Thank you, Senator Claxton. So Representative Zager, I have a question for you, if I may, Chair.
Sure.
I'm assuming now you, Representative Zager, you're asking to include that in our supplemental budget. Is that what you're asking, or are you asking that if there was an error in recording the votes?
I'm asking if, thank you very much, Representative Javner. I'm asking if we could include that. I wasn't sure if there was an error. I was trying to make sure my notes were accurate. And so as I'm looking through it now, I realized that wasn't included, and I thought it was included, but I'm not sure that we had actually voted that into the budget.
No, there was no motion to move it into the budget, so it was not voted on as consideration as part of the budget. The vote was 11-1 in the committee when we considered it as it by itself. Does that answer your question, Representative Javner?
Yes, I'm sorry, I wasn't the one asking that specific question, Senator Claxton. I just wanted to clarify what Representative Zager's question was, because I knew that wasn't added to our supplemental budget. But I will also make a comment, if I may, that I'm not comfortable with adding this to the supplemental budget. If we choose to move forward, then that's fine, and we'll vote on it just as we have every other one that's come before us. But I just want everyone to be aware that I'm not comfortable with putting this specific one, tying it to the supplemental. Thank you.
Thank you for that. Any other comments about where we stand with the letter? So Representative Zager, you've raised the possibility of considering 372, and I referenced 193 and 194 and the idea of moving them into the budget. So I think it depends on a motion from someone about, let's start with 372. Did you want to make that as a motion to move into the budget, Representative Zager?
On a question on a point of order, would we need to motion to reconsider this, since this is language review?
This isn't part of language review. Technically, it's letter review, and we still have not closed out our work on the budget.
I see.
Representative Javner, did you have a question or comment?
Yes, thank you, Senator Claxton. I just would please ask that as we move forward with these pieces, that again, we would just be given the information of what the vote was previously, what the fiscal note is going to be, so that I can write that down in my notes. Thank you.
I will do what I can, yes. So to go back to Representative Zager, did you want to make a motion to move in LD 372?
Yes, I would, Mr. Chair. I move LD 372 into the budget.
Is there a second for that? LD 372, go ahead. Is there a second for that?
I'll second that.
Okay, Representative Stover has seconded that. So LD 372 would increase CHIP coverage to 300% of the federal poverty level, potentially covering 10,000 children and pulling down 25 million for federal. The fiscal note was 8 million, and the voting committee was ought to pass as amended 11-1.
We actually don't have a formal fiscal note yet.
I think it was approximated based on, or approximate note based on what we had from before.
Right. There is a back of the envelope. I'm just saying we don't have an exact fiscal note yet.
Right. Thank you. Any questions about 372? And understanding that we have, not sure what the legislative term is for back of the envelope, but we'll go with that. We have an approximation fiscal note. I'm not seeing any.
Senator
comments.
Claxton, what were those numbers again? I'm sorry.
Sure. I had the fiscal note as being 8 million, but as Anna points out, that was an approximation when we considered the bill previously.
Was that general fund or a combination?
That's general fund.
Okay.
Because that would pull down 24 million federal.
Okay. That's what I was,
as the
thank
match.
you. Thank you.
And we had talked with Luke, or I had talked with Luke at one point about whether that number needed to be recalculated based on a certain percentage of people not participating. He said that was already factored in. to the calculations early on. Does that answer your question, Senator Moore? Okay. Representative Javner?
Thank you, Senator Claxton. I just would kindly request a 10-minute caucus.
Can we, and the answer to that is certainly yes. Can we go through 193 and 194? Or at least-
Absolutely. That was going to be my next request. Thank you.
Okay, yeah, I'll briefly refer to those. The thought on 193 and 194 was to bring them into the budget. The one would be a fund for $160,000. I have to find my notes. Yes, one will be a fund for 100 and I can't remember. Representative Perry, yours was the first 193 or 1993. And that was for the monitor. I can't hear you, Representative Perry.
Yeah, I'm on a new device, so I'm figuring it out still.
Okay.
I was trying to figure out when you were saying 193 and 194, if you were
Sorry.
talking about lines of the budget
Yeah,
or
yeah, yeah.
LDs. You're talking about 1963.
1993 related to PTP.
Yeah, that one.
1993 and 94.
Right. Okay, good.
And
Yeah.
1993 was the monitor position.
Right, and I'd like to see that in the budget. We did, and we did not do that, but we did not have any fiscal note on that as well.
Right. And 1994 was the establishing the fund
Right.
at 160,000.
Right. Right. Do we need to just vote those in if that's what needs to
Well,
happen?
I wanted to at least, can you turn down the background audio there, Representative Perry? Or I think it's.
Sorry.
We're hearing another committee. We're having enough trouble in this one. We're at two committees at once. Representative Javner was going to ask what other bills, what other lines might we consider moving into the budget? And that's why I brought up 1993 and 1994 before we caucused, so we didn't have to go back and caucus again.
Right.
Does that answer everybody's question for the anticipated caucus? If we did that for 15 minutes, would that be adequate, do you think, Representative Javner?
Definitely.
Can I just ask a very quick question? Mostly,
Please.
this is of you, Representative Javner. 372 was actually on the list of bills of amendments to be reviewed this afternoon, but I don't have the fiscal note. But would you like to see the language pulled up on the screen before you go to caucus, or do you not care because I did send it to you?
Yes, thank you, Anna, very much. No, I reviewed all that last night, and I knew it was on the amendment review. That's why I was a bit caught off guard that we're going to add it to the supplemental. So I know I saw all the numbers and everything. So thank you for that.
All right. So let's make it 11:10 that we'll shoot for 11:15. We'll shoot for reconvening. And we'll restart again when Representative Javner, Senator Moore, and I become live. So we're going to take a 15-minute break, 18-minute break, something like that, to get to 11:15. Okay. Thank you all. See you then. Okay. So I thank you. Did you get done what you needed to in your corner caucus?
Yes, thank you very much. Yes.
Sure. All right. So I'm going to go back to Representative Zager. Hear what he has to say.
Thank you, Mr. Chair. I know that we discuss a lot of really important things that are various priorities, and I think that given what the discussion that I've heard before, the corner caucus and other discussions, I think that this we could probably help the priorities that we have more consensus about, but if I were to withdraw my motion. And so I will do that. Regarding LD 372.
Okay. Thank you. Yes, Representative Perry.
Thank you. I would like to ask if in the letter to AFA, and I really want to know if the committee agrees with this, as we've been looking through the last 2 years, the main focus of what we've been doing and the main focus of really a lot of what we've asked to be added to the budget is really been about child welfare and mental health. And I was wondering if we could add in our letter to AFA that our priorities in this budget are, as a committee, mental health, or child welfare and mental health. And I think that might add to what we've added to the budget relates to that.
Any thoughts about
Can
that?
I make that a motion to see if somebody wants to add that? But that was my thinking.
Representative Javner?
Thank you, Senator Claxton. Thank you, Representative Perry. I concur completely. However, I'm just need clarification here then as well as, yes, we can certainly, I'm in agreement that we could add that to our letter, but I do understand though, in the past, there's always been this process as well, where we send, a message to AFA of what exactly our priority bills are. Is this something that you are asking that we do above and beyond that? And I know that, and just somebody, I guess I need somebody to remind me when that priority list goes out, if it goes out after the supplemental budget. I'm in agreement that we can add those two pieces, of course, to our letter to AFA. And I think that, in our report back, we will for sure make that very clear as we communicate to AFA that. So, I think I'm just looking for a little bit more clarification on, are you talking about specific bills?
Yeah.
And when in the process does that really happen?
Well, I'm actually talking about the bills that we've already put into the budget, because by doing that, we have set priorities. And so I think explaining really why we're bringing these forward as part of the budget would emphasize what we're looking at and what we're considering as a committee priorities. That was the reason I wanted that to go
So
in.
you were talking solely about adding language.
Yeah,
and
to our letter to the AFA.
Trying to
that's all.
help AFA understand what we've been
Right. I don't know what I'm doing here.
Yeah. All right. So we can scoot that in the language somewhere, Sam, of the letter that summarizes that a little bit. And I'm going to offer AFA a couple of spreadsheets, one on child welfare bills and the other on mental health bills, to say what the committee's been working on and passed. And I'll start with the ones that were unanimous and then finish with the ones that were divided, to try and make that case. Is that something you can add in there, Sam?
Yeah. Yep.
Yeah. Okay. Any other thoughts before we go? I want to recognize Jeff Austin for a minute, since we don't have a particular bill on the table, and he wanted to speak, I think, to address our intent of making the hospitals whole around the blood spot testing.
Hi, thank you. I've communicated with Sam and he's willing to explain our issues. So out of respect for your process, I'd let Sam explain what we've explained to him. Thank you.
Okay, thank you.
So Jeff had brought up, I think, two points. One was that when they were estimating their fiscal, they were estimating it would start on April 1. So that doesn't change any language that we have in the letter. It's just how they calculated their 550. So I think that's good for Luke to know. But it doesn't change the language in the letter. What the other thing, which does change the language a bit, is the language around the blood spot reimbursement. So because of the complications of rebasing, when we had taken up this bill, Main Care had communicated that it would be complicated to rebase rates just for this purpose, because it's we're largely talking about hospital-based services. So what Jeff had suggested is that we include some more general language that DHHS provide payments to hospitals for increased costs of blood spot paper fees relative to Main Care patients, but not specifically say that reimbursement will come in the form of reimbursement for blood spot tests as part of the rate for that service. So I do have some language Jeff suggested, and I think we can use that, which provides a little flexibility around exactly how the department chooses to pay for those papers.
Which is a good thing. And we approved that as a committee before the language change. Senator Moore?
That was my question. Will that be a language update then, or to the amendment? Is that what I'm understanding?
No, I think this is just for the purpose of, because I don't think we need to change the language in the amendment itself. It's the kind of the corollary to that, which is the money for the paper fees, just in the budget here. I don't think we need to change the amendment, but I will double check that, Senator, while we're doing language review on the other things. I'll double check that and circle back later today.
That's a good question, because it depends on where that language lives right now.
Yeah.
That's what I was thinking.
If it's already in the amendment, then we have to adjust it. If it's not, if it's outside the amendment, then we can flex.
Right. Thank you.
Thank you, Senator Moore.
I think the amendment refers to Main Care, Sam.
Does it?
Yeah, but that's easy for us to change. I mean, in the letter, it does.
Yeah, the letter will fix.
Yeah. And you'll look and see if it's in the amendment, if the language is in the amendment or not, because that would require a language review to fix that, right?
Yeah, but it's unallocated language, so it's not really a huge deal. We'll just adjust it.
Okay. Are you okay with that, Senator Moore?
Yes, that's fine. That'll be great. I also would like a copy of Luke's spreadsheet where he was kind of summarizing those costs. If we could get a copy of that as well, that'd be good for 3, 4, and then the 5. Thank you.
Yeah, that's good. All right. Any other thoughts?
Did you all finish what you were doing with PTP? I'm a little lost.
We did, and we considered the issue about whether to move 1993 and 1994 in or not. We're a little concerned that if there's any reservations in the committee, I'm just speaking out loud here, that we'd end up with a somewhat divided report, and it wouldn't look as impressive as a 13-0 vote on both of them out of committee, and to let it go to the AFA table with those votes and have all of us continue to make it clear that it's a priority. I'll put it on my behavioral health, mental health list as a priority for the committee and note the 13-0. But we've added a bunch right now, and I don't think it materially improves the likelihood that AFA will fund it by voting on it now. I'm just thinking out loud here, people. So you okay with that? Because I was concerned, frankly, with 1993 adding a position, whether that was something you'd feel comfortable supporting. And like I said, we've come up with a number of bills to add into the budget, and they reflect. I feel badly because that was an oversight in the last session and might have been included, but the fact now to go back to it when we already had the list looks like we might be diluting what our priorities are in some ways and hiding the 13-0 visit. Thank you for that opportunity to explain that thinking. Representative Senf, Sam, did you have something?
So I just wanted to follow up. I did just check quick the blood spot. So just to get everybody up to speed on that. So that bill, as it passed, just changed the requirement in statute. And what I wanted to check was the fiscal. So there was no fiscal on the amendment that passed because it was just there was no actual fiscal impact on the state for requiring the testing. So the impact falls on the hospitals, which is why the committee is adding this language to try to make the hospitals whole for that mandate that didn't provide any extra funding to them. So, does that make sense?
Yeah. Yep. So there will be eventually a fiscal note. There will be a spend out of general fund, and I don't know whether it will match with federal dollars, but it's to make them whole. There is going to be some cost somewhere. Yeah, that's all the point I'm making. Okay. Any other items we want to bring up before we get further into language review? Representative Perry, did you want to raise an issue? As soon as you're unmuted, we want to hear what you're.
Well, actually, I know that there's new language that Colleen Mavigan had been working with regarding 1877.
Through these animations.
Okay, can you turn down that audio?
So this slide really framed our discussion for the
Representative Perry, can you turn down the audio on that other committee?
Oh, darn it. Sorry.
It's real close to the mic, so we're hearing it very well.
It is real close. I'm sorry.
It's okay.
But I would like to, first of all, hear the amendment that Anna has and actually ask for reconsideration. But I think it would help if we all heard the amendment that came up, because I think it takes care of the issue that Anna had in terms of this bill.
Okay, so this is part of, in essence, well, it's a move to reconsider as part of language review and not necessarily as part of the budget.
Right.
Right, okay.
Yes, yes.
So
Would you like me to do that one first then?
why don't we do that first then?
Okay, and just to be clear, I don't know if it takes care of the issue, Representative Perry. I drafted it according to what I was given. I would have to ask main care whether it takes care of the issue. I simply do not know.
Okay.
So this is, it was easier just to strike it out, which actually is easier for you to see anyway. So there were a couple of adjustments that this language came from Alicia Melnick. So if you recollect, this is the bill about step therapy and PAs for drugs for mental health. And this was originally modeled on a bill from insurance, which was the problem because it's too easy. It's easier to do it in insurance because insurance companies can pass on the costs. So some of this is based on that. So the serious mental illness definition was in the original bill, and also it is modeled on the language in the insurance bill, except that you added the serious mental illness does not include opioid use disorder, tobacco use disorder, or any other substance use disorder. Just to remind you, this is Representative Madigan's amendment because she was the only person on this at the time. And then the step therapy was tweaked a little bit too by the folks that were working on this to include this tiering. I can't actually say it really very easily, tiering system, but you know what it means. So the step therapy language is basically the same, except that it includes this tier in here. And I actually changed it from step therapy protocol definition to step therapy because there was sort of it just flowed easier once you added it in this language. And then There was a clarification here. This is very similar to the original bill as well, that the department may not require under the main care program prior authorization of step therapy. I took out the protocol for prescription drugs used for assessment or treatment of serious mental illness in adults. So that was added in Representative Madigan's amendment. But this is the language that Representative Perry is talking about. As I said, I don't actually know if it solves the problem or not. So it says that, because if you recollect, this is the bill in which I said I give up. So this is this is about preferred drug lists and the drug rebate systems, rebates that they have as part of main care. And so this language says the implementation of the section and any rules adopted must be consistent with the requirements of the Medicaid drug rebate program. And then the department shall monitor the fiscal impact from implementing the section, including costs to Medicaid that are both incurred and avoided, because the thought was it could cost more because you're not doing PAs, or it could cost less because you're saving money later on. And so that was part of what I was asked to draft. So what I don't know, and because this at the time was a one-person amendment, I don't know what this means on the ground. What I mean by that is I don't know whether by requiring the consistency with the rebate program, whether that means there'll still be a bunch of cases in which a person is still, or a main care member is still required to have a PA or step therapy because of the requirements of the drug rebate program or not. So we would have to ask Michelle Probert that, but that's what that language says. And then the rulemaking is the same, and then it includes the state plan amendment language that says that if the state plan amendment isn't approved by the federal government, by CMS, then this wouldn't go into effect. So that part is clear and easy to draft. The only part that I really don't honestly know is the sort of impact on the ground of this language here in subsection 3. But that's the amendment that I drafted for Colleen Madigan based on the information that I was given from the folks she was working with.
Representative Perry?
Yeah, I do have a question on this. Because really, I'd like to also have the department's response on this. But I don't want to sort of leave this right now. Can we wait until our next meeting so we have a department response on that?
You don't really have permission to have, Molly Bogart showed up. Thank you. You weren't in the waiting room there for last time I looked. So welcome, Molly Bogart. Do you want to introduce yourself?
Oh, okay. Yeah, she have some response on this.
Sure. Good morning. I'm Molly Bogart, Director of Government Relations for the department. And we had not reviewed this, and that is not anyone's fault, simply a product of the timing of and process of amendment reviews. But so I can't speak exactly as to whether or not this addresses some of the concerns from main care. What I can tell you is that moving forward with this would still, my understanding is, eliminate our ability to use the preferred drug list as a leverage for cost control and review of which prescriptions are preferred. Again, all coverage, main care is required to cover a significantly more broad list of therapies than private insurance. But the system of the preferred drug list and the prior authorization is what helps us control costs. And so if we are being told by the legislature not to do that, that is fine. Those are agreements that are optional for the state, but it will have a significant cost related to the loss of the rebates. And so I don't believe that this addresses that concern from us. And on the other technical pieces, I would have to have additional review. And our team is working on things right now, and some folks are out of the office today. And so if been unable to assemble them in 5 minutes, which I think is entirely fair for them. So, we're happy to provide additional feedback, although I don't imagine that this amendment changes our position on the bill.
Okay, thank you.
Thank you. Molly.
I do understand that monitoring was going to actually work at seeing what really is happening, because it's only happening on a certain level of drugs and not all. So my question is, because when they talk about monitoring in this, they also talk about the avoidance of hospitalizations, which is also a high main care cost. And I know other states have done studies with this and have found this neutral in terms of cost to the system. So I guess my question is if we brought this forward with a monitoring to come back with results to see if this really has affected the cost to the Medicaid system in general. My difficulty is do we save a penny here and spend more money elsewhere? Or do we really work at the system and save money in general? And I guess that's the question that I have. And because the monitoring part was put in that, I was really looking at this as being a possibility, and we can always reverse it if things are not going well. And a lot of that can, be set up with rulemaking and stuff. My thinking.
Just to be clear, we don't have a fiscal note on this yet, but I do want to remind you that there would be expected to be a fiscal note. What I mean by that, this is the comparison I always use. It's insulating your house, right? So yes, you save money from insulating your house, but you have to spend money to insulate your house. So in order to move forward with this, my understanding is there will be some sort of fiscal note, so it will still have to get off of the table. So maybe you do save money in the long run, but it will cost something to do in the first place. And Molly can tell me if I'm wrong about that.
No, you're right, Anna. Although I was headed in a different direction with my comments. I'm glad that you made that. But part of my response is just that, as we shared in the work session, the department's average turnaround time for prior authorization is 4 hours. And I'm not a clinician, and I know I'm speaking to a clinician, so I hesitate to, make conjecture here, but I'm not sure that we're going to see that turnaround time makes a big difference on the long-term impact of whether those, therapies were available to someone, and whether that 4-hour time frame makes demonstrates a significant savings. I think we'd have some skepticism that would be the case, but that monitoring will allow for that to be reviewed, but it won't eliminate the problem with the rebate program.
Any response to that, Representative Perry, having heard that feedback from Molly?
Nope, I expected that.
Okay, all right. Representative Zager.
Thank you, Mr. Chair. I really appreciate what the department does to get those turnaround times down to where they are. For the committee to consider, though, there's a huge amount of work and personnel that is not clinical that goes into administrative and paperwork on the other end to make to kind of submit those and track those and follow up and so forth. And so that's a huge disincentive, and that's how the insurance industry. That's a weapon that they use in this effort to try to reduce costs in the short term, because they don't have a lifelong horizon. That they have a short term, and I think we as a state we have a longer term horizon, and so I while we don't know for sure, because this study has not been done in Maine, it has been done elsewhere, and some of that was submitted in the hearing. There's to me a very plausible case to be made that the long-term money will be better for the state, and of course also people will do better clinically in the meantime.
So Representative Perry.
Yes, well, I think at this point, we've had our discussion. I would like to move to reconsider 1877.
Is there a second for the move to reconsider?
Second.
Okay. Been made and seconded. Any further discussion about that before we vote on the move to reconsider? That's all we're voting on. So why don't we do this with electronic hands? All those in favor of reconsidering LD 1877, please put up your electronic hands. So I get 9. Unanimous of those present for reconsideration. Thank you. Put your hands down, and then we'll go back to Representative Perry for what you'd like to do with us now.
Yes, I would like to move ought to pass as amended, the amendment that was just presented to us.
Okay. Any second for that?
I second it.
Thank you, Representative Zager. So it's been moved and seconded. Any further discussion? Then I think we'll go to Karen to collect the vote on the motion, which is ought to pass as amended. If you'd run the tally for us.
Thank you, Senator Claxton. Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover. Representative Stover is absent. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Madigan. Representative Madigan is absent. Representative Craven. Representative Craven is absent. Representative Connor.
No.
Representative Connor, no. Representative Griffin.
No.
Representative Griffin, no. Representative Javner.
No.
Representative Javner, no. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that's 5 yay, 5 nay, and 3 absent.
I have 5 yay, 4 nay,
Okay.
4 absent.
Okay, thank you. So if the numbers stay the way they are, the nay minority report would be ought not to pass. That's a question to Representative Javner. Okay.
Apologize. Yes, Senator Claxton.
Okay. And if the yays, okay. All right. So it's 5, 4, and 4. Okay. Molly, do you have your hand up?
Yeah, thanks. And I appreciate that this is a policy decision that the committee is making. But I didn't, and I don't think Representative Zager meant this as perhaps it came across, but using the word weapon as this is a weapon that is used against main care members. Main care is wildly different than private insurance. We do not have profits. We are responsible for administering the program within the federal guidelines. And I needed to take the opportunity to remind the committee how different main care and Medicaid is from the private insurance companies. And, you know, I appreciate, we've done a lot of work with Representative Zaker this session on private insurance in HCIFS. And that is not certainly a call out of him and the good work that he does on that. But I just needed to take the opportunity to remind the committee that these are really different animals. And I just thank you for your latitude in making that comment.
Representative Zager.
Thank you, Mr. Chair. I'm so appreciative that you said something. I did not intend to imply that that main care was weaponizing. I thought that I had said that this is something that private insurers do in that context. I fully appreciate that the devotion that main care, the Office of Main Care, and all the people who work in it have to the wellness in all dimensions of the folks that are under its care. So I really appreciate what you said, Molly, and I apologize for any affront that you thought that may have come across.
Thanks. I just wanted to remind folks of the difference. Thank you.
Just doing your job. All right. So now we can go back to Anna for some more language review.
Okay, so I was going to do this one later, but I'm going to do it now. This is 372. I'm going to show you the amendment, the majority amendment first, and then I'm going to go to the original bill because it's a little difficult to read at the beginning. So this is the majority report, which is, this is a 12-1 report. This is just, as you can see here, removes the language from the bill that was related to non-citizens because it's in the it was in the budget last year. And these are just cross-references that go along with that. I'm gonna go to, actually, I'll go to the other one first. Did that switch over? Can you now see the minority report? Did that work?
Yes. Yep.
Okay.
No,
So
I can't tell this from what we just saw.
do you see a 300%?
Yes. Yes, I do.
Okay. So this is the minority report. This is Representative Lemlin's report. Most of it is the same, except for this piece here. I realize this is awkward to look at, but it's the only way we can do it. So this is striking out what was in the amendment, in the bill, and putting the 200%, which is actually going back to the current law. So I realize that is slightly awkward to look at. Otherwise, it is the same. I just want to go to the bill for a minute so that you can actually see what you're looking at. So this is what we were referring to. So this piece is in section 1 is in, and 2 are in the majority report. And these are the pieces that are, that's why it's so awkward to look at in the minority report. It's just a function of the fact that we're working with a bill that amends the law and actually going back to the current law. So it's not complicated in any other way. It just looks odd on your sheet of paper. So what you all did vote for, so this is still a 300%. This language doesn't change for anybody, but what I wanted you to see is this is the piece about the premiums. So the premiums for CHIP go away in both amendments because this is in the original bill. The 19 and 20-year-olds are in both amendments. The non-citizens is gone from both of them, and this is the premiums again. And then there is also some language about outreach, which is included in both amendments as well. And then there is the unallocated language that doesn't change. So I just wanted you to see that because I realize it's hard to look at that in relation to the amendments, because the amendments will literally just strike things out. So that's those ones. I'm assuming that those are okay as they are. There will be fiscal notes, and when those fiscal notes come, I will pass those on to you.
Any comments about those two, both the majority report and the minority report? I assume everybody can live with those. Very good.
Okay, so back to this screen. Oh, I'm going to close this and this. Hopefully you are looking at 1853.
We
Are you
are.
looking at, okay. So this is perhaps the only unanimous report I have today, I think. So this is has an emergency preamble on it. You have seen most of this language before at the work session, I think last week. So this is the first section is the piece that requires 2 of the 3 citizen panels, the MCWAP and also the Child Death and Serious Injury Review Panel. These are the 2 that are in statute, to submit reports quarterly to this committee. I did have to put some dates in here to make it clearer. I did put the 3 months beginning in June 2022 because it sounded like you wanted to meet in June 2022, and it does have an emergency preamble on it, and I would be surprised if it had a fiscal note. So beginning in June 2022, and you wanted 2 years, so that's 2 years worth, and they could choose to do combined or separate reports. And then this is slightly unusual language because we don't usually refer to the presentations of the reports in committee, but we have, for the purposes of this, I'm hoping that revisers don't bounce back on it, but if they do, I shall push back. You wanted presentations of the reports to the committee to be presented by citizen members of the panel as much as possible. And then this is the at minimum language rather than only because included but not limited to didn't fit into the sentence, but it's the same meaning, is the generalized and de-identified observations of the prior 3-month period regarding this is from the citizen panels, regarding the department's efforts to improve the child protection system. You requested a summary of the collaboration. This is between the 3 panels. There is also one, this Justice of Children Task Force, which is in the judicial branch, so you can't compel it to do anything. So the easiest way to get around that was to get a summary of the collaboration. Then any recommendations on how to further to make improvements to the system. And then this is the department side of it, providing the quarterly reports to this committee. This is the same language of 3 months beginning in June 2022 until June 30th of 2024. And the reports include implementing the recommendations of the Casey Collaborative Safety report that was received last year, responses to the recommendations from MCWAP, and also their progress in any efforts there's the annual report that you received on child welfare. So any progress on what's going on there. And the same, this is the include but not limited to equivalent efforts to further coordinate, and you saw all of this language, coordinate and advance services. And this is a piece that Senator Claxton asked me to add. This first this first bullet here is an addition, efforts to further coordinate and advance services in primary, secondary and tertiary prevention. I think much of the rest you saw, the family team meetings, the use of people with lived experience into the development of policy, the review of departments' policies and practices regarding domestic violence and the non-offending parent, efforts to work with the Guardian ad litem review board under the Board of Overseers of the Bar. This is another one that you couldn't actually tell them to do something, so the department could work with them, and then any recommendations. And then just the general authorization for the committee to report out legislation to the next regular or special session after any quarterly report, because you don't actually know when that would be. In other words, you could meet in January and have some ideas about things, but you wouldn't be able to do it until you came back into session. And that applies to both the citizen panels and the department. So that one is complete if that one is all right with you.
Any comments on 1853, the way it's been adjusted? Not seeing any. I'll assume that people can live with that unless somebody puts a hand up.
Okay.
Very good.
Moving on. Keep losing the screen that I want. This one. All right. This is 1850. This, I believe, is a divided report. So this was the bill that was, this is Representative Hymanson's bill. It was originally drafted to provide funding to the Alternative Response Program. This is the one that puts funding into the high fidelity wraparound. At what you did in this one was to take the funding that was applied to the Alternative Response Program for the next year, because that funding was going to end, so you only had 1 year of funding, and apply that amount of funding on an ongoing basis. So that's where that amount comes from, and that's what the majority of the committee determined would be an appropriate amount of money. And then it was this language here. I'm not sure it's going to stay in this order. I think the revisor's office will probably make us put the language before the funding, but this is the language that was originally that the department asked for, but it can't go in the blippy because it's really not blippy language. So I told you at the work session that it would probably have to go into some unallocated language, but this is the language that the department asked for. It's just not up here in the blippy, it's down here. And this is Luke's work here. And so this one is still in process, and this is a majority report of the committee. So if that one's okay, that one is, you will get a fiscal note back for that, and at this point in time it will have the 3.1 million for each year ongoing beginning next year.
Okay, thank you.
All right. Oh, thought I had shut it. Okay. All right. So this one is this is Representative Madigan's bill. This is also a divided report. This one, and I can bring up the original bill if you need to see it, but it was easiest just to pull out the language that you wanted and put it back in as opposed to marking up the original. So it's actually easier for you to see. So that's always helpful when that happens. So
Anna, what's the bill
yes.
number? What's the
Oh,
bill
I'm sorry. This is 1825. Sorry, Senator. So this is the one that puts a limit that the department shall ensure that a caseworker does not exceed the work or driving hours established pursuant to the subsection. The department may not require a caseworker. Oh, and I did actually change this. It was Sam that picked this up, that it's work or driving hours, because it did say work and driving hours, which actually there are different limitations here. So the department may not require a caseworker to work more than 60 hours over 7 consecutive days or 70 hours over 8 consecutive days. And the department may require a caseworker to work for up to 14 hours at one time. That was inserted there to be clear that that was at a stretch following the 10 consecutive hours of not working. But the department may not require a caseworker to drive for more than 11 hours during that shift. And then this is the language that was included to say that a caseworker, this is the amendment really, to, let me just turn that off, sorry. A caseworker supervisor in consultation with the commissioner or commissioner's designee, that's really OCFS, may direct a caseworker to exceed the maximum number of hours established in this paragraph or this paragraph in circumstances that could result in an immediate risk of abuse or neglect to a child as determined in department policy. And then the summary does just tell you that all the other pieces are gone. The pieces are surrounding the driving log, a maximum caseload, also the sections that would have repealed the resolve that you currently receive a report for for a 10-year period, which you are partway through, for the caseloads among caseworkers. So that is also a majority report. Okay, so I'm going to do one more and then I'm going to switch to Sam so that I can bring the rest of mine up. I do just want to tell you that I had 1824 on the schedule, but I'm pulling it for today, so you can pitch that one. which is the one related to the indigent legal services. I'm going back and forth about language with indigent legal services. In fact, that's what the phone call was. But I'm having to pull that now. So just so you know, that will be another one coming back around. But before I give over to Sam, I will rid of this. This is 393. This is also a divided report. So this is in Luke's hands right now. He still needs to fill in the accounts here, but you can see what the amendment does, and you can even mostly see the cost. I think this anticipates what the fiscal note will look like. So this has $1 million going to the Home Builders Program, $1 million going to the Parents as Teachers program, which is in the home visiting program, and then $420,000 in each year for kinship navigators for the contract, and then the $200,000 that goes to the Child Protective Services Contingency Fund. So this looks very similar to what you looked at during the work session, except that it removes all the offending, what I was trying to be helpful, headings that don't actually belong in the amendment that were incorrect and so offended everybody. So they're no longer here because you don't actually put headers in. So that's the last time I'm going to try to be helpful, I think. Or at least a person who doesn't know what they're talking about trying to be helpful is really the problem. And then there is this funding for one full-time position to coordinate the organization of child abuse and neglect prevention initiatives across the department. This is the piece of the fiscal note we don't know yet, but you know that it will be a position cost going forward. This is the contingency fund language that you saw before. This is existing law. It just requires the contingency fund is existing law in here in section 404, subsection 1, paragraph D. This just moves whatever it is spent on into the annual report that you receive. And then this is the section about requiring the department to figure out the services that a person is receiving, that a parent is receiving before a child is removed in the home, the ability for them to continue to receive those services while the child has been removed, but the family is still involved in reunification. Because we don't know what that world is. You know, there may be some of those things that are required, that federally are not allowed for a person who doesn't have a child in the home. And so this would require the department to figure out which supports a person was receiving prior to the child being removed that they could continue to receive as long as they are engaged in rehabilitation. And the same for services that are waitlisted. So that includes things like transportation, childcare, housing assistance, and so on. And then also the priority for waitlists, because there is the ability to prioritize, for example, behavioral health services for children that are involved in the child protective system. We already know that, but we don't know what it means in terms of when a parent, when the child's been removed from the home. And so that, because we don't know that, that would be a report that would come back to you. And then this is the language that goes along with the position, which you also saw at the work session. It was on the bill analysis, not on the draft that you received at the work session. So that's just been sucked right into there. And also, I think Molly had told us what that position should be called, which was the Special Projects Manager. So that is that one. You will receive a fiscal note at some point, and you will also see a finalized version that has the accounts in there. But that is also in the loops right now, and is also a divided report.
Okay.
And Anna.
Yes.
And the emergency is removed.
Oh, yes, that's right. Thank you for reminding me that. So I was asked after it was voted to remove the emergency. So we're just letting you know out loud that the emergency preamble has been removed from that. It was never on the original bill because the original bill was a concept draft. It was on, but it was on the draft that you voted. So yes, thank you for reminding me about that, because I had already managed to forget that we needed to clarify that with the committee, that the emergency preamble has been stripped.
Great. I think I'm doing the next one. gonna go ahead and share my screen. All right, so this should look pretty familiar because you just saw it last week. So this is LD 1787. This is an act to improve the quality and affordability of primary health care provided by federally qualified health centers. So the changes made from what you saw last week are very minor. So for example, spelling out FQHC, there is one change here. I did just simplify that sentence a little bit, but it did not change the meaning. And I did run those that language by Attorney Dingman, who had been working with the department and Senator Claxton on this bill. And he did take a look at it. So again, it is what you saw on Friday with the change in methodology for FQHCs. So does the committee want to run through it again, or are you good?
That's the substance of the change. Are there any questions? Not seeing any, so I think we're probably good on that one.
Okay. I have a few fiscal notes. They're all very simple. So this is LD 343, an act to set aside funds from federal block grants for certain communities. This is one of those minor cost increases from the general fund. And that would be for any cost that DHHS has to establish that that one-time review of spending in the maternal and child health services block grant to pull together that group. That's the first one. Second one is the fiscal note for this is the naloxone bill. There is no fiscal impact, so no fiscal note required. I just always send them just in case.
Thank you.
This one also is pretty straightforward. This is the an act to restore funding to the state's tobacco prevention and control program. I think everybody knew what this was going to be. It's $5 million a year. So this is Fund for Healthy Maine money, and I think that this was this amount was included in the bill analysis.
Yep.
So
yep,
no surprises. And then last one, an act to remove restrictions on syringe service programs. Again, no fiscal impact, no fiscal note required. So a pretty easy set of fiscal notes there. That's what I've got.
excellent work, excellent work.
And I don't have any fiscal notes because I'm slower than Sam at getting my work done. So moving on.
You had more on your plate.
I don't know about that. I just am differently organized. All right, this is 1608. This is Maine Care for All. This one will be ringing in the back of your brains for like, this was a long time ago. It's true. This was a long time ago. This was at the beginning of February. It was at, for whatever reason, it's just one that I did not get done. So this is a minority report. I believe I included that in the email because there is a question here of who the minority was. So this was Senator Claxton, Senator Baldacci, Representative Zager, and Representative Madigan. So this was slightly awkward to put in the bill, which if you would like me to bring it up, just shout out and I'll do it. So this is the bill that actually I kind of find my part of my folder myself. So this is the bill that would require that establishes through a period of time a Maine Care for All system in it. So it has some phases of implementation and sort of design. So the design piece says what needs to be included, but then there's an implementation that starts with, we should have fixed that actually. Don't let me forget, there's a change that needs to be made here for the minority that voted for this. So phase one started in January 2022. That has obviously been and gone. I'm assuming that you will need to move all of these dates 1 year forward since this was a bill from last year. So I'm hoping that somebody on the minority, so I see Representative Zager just nodding at me. So I'll bring that up in just a minute. But then it also establishes the Main Care for All Implementation Task Force, and this seemed to be the easiest place to put in what you asked for. So what the question was what can we do for individuals who are satisfied with their current insurance plan so that they could keep it? And I said I didn't quite understand how that worked, and the response was, well, it's a plan. So the way that will take some time to be implemented. So as long as you are okay with this, the way that I was able to draft this was to include it into the plan that the task force would be developing. And I included a paragraph. It's G because that seemed the most logical place to sort of put it in terms of the things that needed to be in its legislation, was to ensure that individuals in the state who are satisfied with their current private insurance plan are able to maintain that coverage during the implementation phases. And this is Title V sections, just the other part of the bill, until the Main Care for All program is established and fully implemented. Because at that point, there is no health insurance, there's no private insurance. So at some point that has to actually go away. So I'm hoping that meets the needs of what you asked for. And then the other question that came up that I would never have ever discovered is that apparently, because there in phase 1 there is a request for proposals, it's actually self-funded by outside sources, which makes the question a little bit more confusing to me. But what I was told by the accounting folks over in the executive director's office is that it requires some kind of number to come up with. So for example, an RFP costs money. So the idea is, how much should that be? I think that's so there isn't sort of a ceiling that is like there's no limit to it. So for example, the one that I'm most familiar with at the moment, because it's how I spent some of my interim, is the family and medical leave study that went on through the interim, had a $200,000 actuarial study funding piece in it. This isn't asking for the funding, I believe. It's asking for a sort of limitation, because the language is written to say that the request for proposals must be self-funded by outside sources unless it's covered within the normal operating costs of existing programs within the biennial budget. So I think that means it doesn't require appropriating money. And then the clarification that goes along with that is the task force includes the consultants that can be appointed to that, and that language, and I will show it to you in a minute so that you can see it, includes that those persons appointed as consultants not otherwise compensated by their employers, would also say or in their contract. So that's just a clarification. But let me go to the bill for a minute so that you can see what I'm actually talking about. And let's hope that I actually remember to bring it up. Is that it? No. Okay, sorry. Hang on one moment while I bring up the bill, which I thought I had brought up the bill, but I guess I haven't. Are you looking at 1608? Can you see? Okay. Yes. So let me go down. So this is the section at the beginning with the design of the program. This is the implementation phase. And I just realized as I was looking at this that this is last year's bill. So these dates were presumably based on, for Representative Sylvester, whose bills it was, presumably that's the timeline he was looking for. So these, I think, would also need to be advanced by a year in each of those phases, if you are good with that. So that's the first part. And then you can see this language, right? Can you actually, do you need me to blow it up? I'm sorry. Is that blowing up for you at all?
Oh, that's better.
Okay, I'm sorry. So you can see in this is the section here that I'm talking about. In subsection 2, it says that that the department shall convene a committee that shall authorize a request for proposals for a full study of the costs, economic benefits, and issues, including any federal waivers related to expanding coverage through the program for all residents of the state. This request for proposals must be self-funded by outside sources unless covered by the normal operating budget. So this is, I guess, and I'm still getting some clarification on exactly how this would work. But what I was asked for is for the folks who are on this report to identify some kind of number to come up with that. And then I'm just going to carry on. This is the task force, and these are the recommendations that the task force shall submit recommended legislation. And this date would need to change as well. And this is where I added in the paragraph G, because that seemed the most logical place to put it. But as I said, it would be a temporary thing. If you liked your insurance plan, you could keep your insurance plan through the period of implementation, understanding that there is no way to put it into a main care for all sort of single payer system in the end. So I'm hoping that that meets the needs of the four folks who are on that amendment. So just want to make sure that A, it's good, B, that it's okay for me to move those dates, which I had actually not identified yet until just this minute, and C, an amount to go along with that amendment for a cap.
Any thoughts? Want to just go with 200,000 for the other study? Yeah. Sounds good.
Okay, and the amendment's okay with all of you?
Yep.
The four of you? Okay. Representative Zager, did you have something you needed to add?
Mr. Chair.
Go ahead.
So, Anna, you, at the very end there, thank you very much for all that work and analysis. At the very end there, you said that it would not be possible to ultimately for people to keep their insurance if they chose to.
I mean, the way this is worded is main care for all. I mean, it is written to bring everybody into the system in phases. So I don't, and that's why I asked the question at the work session. It was Representative Sylvester's sort of suggestion, well, it's going to be years before the implementation is completed. And so it could go into that sort of developing the plan. Maybe there's another way to write it so that it just says that they could identify ways to do that, but I'm having a hard time with the sort of internal consistency of that.
Mr. Chair, that I think is, that's a significant point in terms of how I feel about the policy. And I also recognize this is a minority report, and it's not, I don't know how much, the committee or the committee staff can put more into this. So but I'm not comfortable being on this report if it would mean that people would not be able to ultimately keep their insurance that they prefer. I had intended for people to be eligibility for all, essentially, on main care. That was what I had tried to articulate at the work session.
So it's you and me, Sam, are the only two on the minority report that are here to discuss this. I share that concern too. So the alternatives are to reconsider and change the vote, or to ask Anna to take another crack at trying to figure out a way to leave private insurance as an option when main care for nearly all or many matures. Do you have any thoughts about that?
Suppose it was main care eligibility for all. Would that be a simple drafting change that would?
I would have to look into that, but I can certainly try.
Yeah. Okay. Sounds like a reasonable way to go.
Okay. All right. Okay. What else do we have left? Are you looking at 1574?
Yes.
Okay. I do just want to remind you that this bill also is an emergency. I always forget to point that out on amendments. So this is a bill that also has an emergency preamble. This is a carryover bill that was drafted quite differently before. And what happened at the work session was, as opposed to coming up with a new rate, which is how the bill was originally drafted for, this is individuals with intellectual disabilities or autism who have behavioral management plans. Did I remember to change that header? Yes, I think I did. So what the majority report of this did during the work session was to, instead of requiring a new rate for individuals with intellectual disabilities with, I believe it was just slightly differently worded, but behavior management plans, instead of coming up with a new rate, the vote was to apply a rate that is used for something different, which is the agency home support medical add-on rate, to apply that rate for this purpose. This will presumably have some kind of fiscal note. Obviously, I don't have it yet because I only just sent it yesterday, but that's what this language does, is applies the rate that is used for medical add-on for basically behavior management plans. And as I said, it does have the emergency preamble on it because I always forget to bring that up when you're voting these things. So if that one is good to go, I will send along the fiscal note when we get it. Okay. One more. Sorry, I'm trying to get my thing out of the way so I can see it. There we go. This is LD 533. This is another one of those bills that I had to basically give to Luke to draft. So this is Senator Breen's bill. This is the one that has the pilot project for the statewide voluntary early childhood consultation program. And you saw an estimate, and I'll bring it up in a minute to remind you, you had an estimate from Molly, which was solely an estimate for the purposes of the work session, of how much it would cost to take this program statewide. And so Luke has put that into the amendment for us, and you can see there are two positions associated with that, and then the funding that goes along with it. This is again a majority report. This is a 3.68 million total in fiscal year 23. I just want to show you, just to remind you of the, all right, where's my email? Here. Can you see that? I don't know if I know how to make it bigger. So this was what you had at the last work session. The reason I bring this up is because I want to show you that this is the estimate of the whole program. And then this is the piece that was already funded before. So the amendment is this amount here. We realize these numbers don't add up perfectly. Luke has fixed that. We're not quite sure where the addition problem was, but it's just an addition problem slightly here. So that this amount is what is in the bill. And you can see that there are two positions here. It looks like 4 or 3 rather, yeah, 4, but that's because there are already 2. So you back those out. So that's why there are 2 positions in there. And then the rest is the funding. And then we did check with the department because there were the pilot has some federal funding associated with it. So we asked about whether there would be any federal funding, and Molly said that they are currently using federal funding for the expanded pilot, but that is temporary for the coming fiscal year. We will have some federal relief funds, but going forward, all state general fund for the expansion of the bill. Once the amendment comes through, will be a detailed fiscal. In other words, this is an estimate only. It could be more, it could be less. We don't really know yet, depending on whether there's any federal money involved. So I think we know how much the program costs. We just don't know how much is necessarily general fund. But that's the approximate. That's what we send over, so that Luke can then send that to the department to get the more detailed fiscal note. And then when that comes back, we'll send that. Well, we'll give it to you, but that will be what will go to the revisor's office and will show up in the amendment. So that's the best estimate we can give you for now. And that's the last one I have, because I've had to pull the other one. So I do have 3 more left to draft, plus the Indigent Legal Services one. We will have to meet on that at some point, or it'll be sent to you by email, who knows yet. And there are obviously a number of fiscal notes to come. Luke, Sam may be a girly swat and have his already, but I do not. So they will come. And I will work on a redraft of 1608.
Very good. Thank you.
Yeah. Oh, and I also believe that you have, before you finish, I believe that you also are going to do one quick report before you wrap up.
We understood that Representative Lemelin wanted to do a report.
Yes, thank you. I have been just sitting here anticipating the joy. I have a report back from the Chief Justice of the courts on LD 38. We asked them for a report specifically requesting data regarding the number, location, capacity, and current medical examiners, and whether they are authorized to prescribe medication. The report basically says we're failing, but they're keenly aware of the scarcity of independent examiners, and they would love to work with us to try to solve the problem so that the Maine citizens, the courts, and the hospitals have increased access to independent examiners. The statute covers both involuntary commitment as well as involuntary treatment. The involuntary commitment, the court must appoint a medical practitioner to examine the patient. A medical practitioner by statute is a licensed physician assistant, certified psychiatric clinical nurse specialist, certified nurse practitioner, or a licensed clinical psychologist. If the application has involuntary treatment, then the medical practitioner, of course, has to be qualified to give out medications. There are 7 court locations where involuntary commitment cases are heard, and they have to be in areas where there's also a hospital. There are only 6 psychologists in those areas who can be appointed to the cases in 5 locations: Augusta, Bangor, Lewiston, Rockland, and West Bath. And they say that to further compound the problem, it is anticipated that at least 3 of them will retire in the next term. When requesting an involuntary treatment in 4 court locations, Augusta, Lewiston, Rockland, and West Bath, the court has no independent examiners qualified to give out prescriptions. So, this includes large psychiatric institutions such as Riverview. As a result, the hospitals in those areas do not file requests for involuntary treatment with the court because the process is simply unavailable. This also creates a conundrum that the individual treatment plan presented to the court under the statute will include psychiatric medications for severely ill patients who refuse medications. The problems have been dealt with in Biddeford and Portland, and since April of 21 in Bangor, because we now have a contract with Behavioral Health Resources of Maine. Under that contract, that provider provides independent examiners to specific court locations, including a small group of psychiatric nurse practitioners who are qualified to prescribe medications. The problem is, of course, that organization is limited to treating those, to giving volunteers in that area only, because there's just not enough staff to service all the courts. Consistent with the independent examiner is there is further hampered by two factors. So there's two additional problems, according to Chief Justice Valerie Stanfill. One is qualified examiners. Otherwise, qualified examiners are not independent because they work for Maine Health, Northern Light, or the state of Maine, and they can't be an examiner if the patient is also in care at those hospitals. The second problem is the reimbursement rates provided by the courts via legislative funding is very low. Currently, it's $100 an hour for those services. This rate has not changed since 2010, and it covers the practitioner's time related to evaluating the patient, writing court-related reports, and testifying in court. In today's market, practitioners charge far more for these services. When this Chief Justice was in the district court, she claims that she tried to get psychiatrists and they laughed at her because the amount was way too low and wouldn't even cover their cost. So the judicial branch understands the critical importance of increasing the number of independent examiners so that the patients in hospitals in all parts of the state have access to qualified examiners, including those who can prescribe medical treatment. And they're looking forward to helping us, but they feel that there's a serious problem. Thank you.
Thank you. Did they have a suggestion of what the hourly ought to be? Did she?
No, she did not.
That would be
I
part
would
of the
like to
next
know that too.
Yeah, that'd be part of the next step. Any other questions for Representative Lemelin? Thank you for that final book report of the year.
So I'm
Any-
sorry, I have three quick things, Senator.
Sure.
So the first one, these are two clarifications. So first of all, I just got an email that wanted to remind me that 533 is not a pilot program. She is correct. It is an ongoing funding. It is drafted that way. I misspoke. The second is LD 1968, which is the bill you started with. I did get an email that I had not realized this. This is my misunderstanding, I guess, that the email was not officially from the judicial branch. It was from the Languishing Committee. So it came from Justice Mills, but it was from the Languishing Committee, not actually officially from the judicial branch. And I hadn't realized that. And the third thing is, because Luke is such a superstar, he, while we were doing this, has done 393. So I'm going to show you 393 again, if that's okay with you, because it does also show you really what the fiscal note will look like. So this was the beginning of the bill where it had all of the appropriations and allocations. And this was the piece that we didn't know right here at the start. This is the position for the social services manager position. This is the special projects person. So that is that's the piece of the fiscal note we didn't know. And then the rest of it, he's put in all of the accounts here, but these amounts were already known amounts. But this is how it will look. It will look more like this when you get it, although it may be differently organized, by which I mean that the appropriations and allocations are usually at the end. But I will send that to you. Yay, Luke, quickly on it. So since I had that update, I wanted to show you what it would look like, and that we now had some estimate of the cost for the position, which is the one piece we didn't know. So I just wanted to quickly get those out there.
Very good. Yes, Representative Zager.
Thank you, Mr. Chair, for your indulgence and the committee's indulgence. I realize I've been on mic a lot today. Just to add a couple of thoughts from my remarks earlier on LD 1877, which is the step therapy bill. I do not believe that anybody has any intent to do any harm, whether they work for the state of Maine or in a private firm or private insurer. Private insurers have a legal responsibility, fiduciary responsibility to shareholders to act in the financial interest of the shareholders. And different firms have different paths that they navigate between that requirement and also the humanitarian intent of providing healthcare to people. And so there's that variability exists. And I just wanted to add those comments because I know people are all trying to do the best they can given the system that we're operating in. And I appreciate the committee's indulgence.
Okay. Any other issues to come before? Sam, do you need anything other than more time? No. So, all right. That being the case, then
We all just received our links for Friday too.
our what?
We all just received our links for Friday at 11
Oh.
o'clock for appropriations.
Okay. So we
Are
will
we-
be.
Can we just visit what our Friday schedule includes? Are we returning here to HHS after?
No, although I was going to ask if you had all wanted to, if chairs and leads wanted to meet to see if it was worth having more amendment review on Friday morning beforehand, is what I was going to suggest. But that's your call. But that is certainly one possibility. I could have my last three by then, and maybe we'll also have fiscal notes. I'm not really sure. Things are a little bit slowed down because of the mess in the State House right now. But I was going to suggest that possibility to you, but I didn't want to ask you.
Senator
Mike.
Moore, Rep. Javner, and Senator Claxton, are you available for a chairs and leads today?
Sure. Can we go right to it?
Yeah, because I have got a work session on a bill over in state and local government. And I'm not sure if they're going to take it up right at this moment or not. I'm waiting for them to come back from lunch.
Okay.
But that's fine. I mean, I can jump on chairs and leads right now.
Are you available, Anna? Sam?
Yeah, I can set up a meeting and send you a link. So just look for your email.
Great.
Thank
I'll
you.
have to set it up.
Okay.
Thank you, everybody.
Thank you.
We'll have occasion to meet again, it sounds like, but
Hi, guys.